Hello and welcome everyone to another one of our online info sessions. My name is Hannah Strack. I'm the admissions counselor at ACTCM, and next to me is Professor Jonathan Wheeler. Dr. Jonathan Wheeler, you have a DA1, correct?
Correct.
Excellent. And he will be demonstrating Tui Na massage and talking about how it is one of the healing modalities that we teach here at ACTCM. So I will pass it over to you. Tell us a little bit more about yourself and your TCM journey.
Yeah, I've been working for ACTCM for 10 years at least, maybe more. I graduated from this school in 1999, and I had a great Tui Na teacher. His name was Rocky Wang. He kind of brought a certain style of Tui Na over to this country, and he practices now privately in San Rafael. So if you want to feel what real Tui Na feels like, you can go get an appointment with Rocky. He'll beat you up pretty good.
Sounds like fun.
So I really enjoyed learning Tui Na, and I use it in my practice pretty regularly. It's a physically demanding thing, but I think the patients really enjoy it. And so, and I teach lots of other courses in the school. I teach points and acupuncture for disease, TCM nutrition, and the Tui Na class.
So to start us off, what is Tui Na, and why is it important?
Yeah, Tui Na, they call it the mother of all massages. It was mentioned in the early classics way, pre in BC, like 2300 BC. They talked about it as one of the 5 main modalities of Chinese medicine, and it has its own department in China. It's kind of like the orthopedic department here, and it includes bone setting and sort of joint manipulation like a chiropractor would do. So here in this country, that's not part of our scope of practice, so we kind of limit what we do as part of the Tui Na. You learn the techniques, but you can't actually do some of that stuff here the way it's done there in China. It can do just about everything that acupuncture can do. I mean, if you think of it like acupressure, that's one of the techniques is just doing acupressure. So you activate the points, you get the same results as if you put a needle in there. And one of the techniques is called, is basically duplicating the effect of a needle. You use one finger and to stimulate a point over a long period of time. Probably the benefit of a needle is that the doctor could put them in, leave, and go treat somebody else. And in Tui Na, it's more hands-on, so you can just do one person at a time. And that's probably one of the main reasons they figured out to use needles, I think. So in the class, there's a didactic part where we learn about what Tui Na is, what the history was, who used it in China, and what it was used for. And then we learn a set of basic techniques over 15 weeks. And the class also includes a pretty substantial amount of Qigong, which is, sort of a Tai Chi, Qigong. It's like a meditation and breath awareness and different types of exercises to strengthen your own Qi so that you can work on somebody else, because it is a demanding practice. So we do Qigong in the class every week as part of the class, and we learn a pretty good chunk of Qigong that way. And then we practice 1 or 2 techniques a week. Some of them we have to start out with just working on a rice bag rather than working on somebody else. And everybody gets to work on each other, and it's a great class. There's some contraindications to it. You shouldn't be working on people with infections or broken limbs, cancer, burns, Some advanced arthritis would be good to use. Post-surgery is okay. First and third trimester, you don't want to be doing too much Tui Na. You can do some. It's a matter of how vigorous you do the techniques.
During pregnancy.
Yeah.
Okay.
I mean, the first trimester for sure is one of the most dangerous, I would say.
Really? Why is that?
Just because if there's any tendency towards having a miscarriage, stimulating the wrong points would help that along.
Wow, that's really powerful stuff.
Yeah. So I'm going to demonstrate a back treatment on Hannah, and you can watch me do it, and I'll talk while we're doing it and talk you through what some of the things that I'm doing.
Sounds great to me.
The thing about Tui Na that differentiates it from other the massage styles is generally it's done clothed, and so there's not a lot of use of oils and salves and things like that. There are techniques for that, and sometimes when I'm doing a massage, I'll use oil on a person's arm or leg or foot, something like that. And it also includes adjunct modalities like cupping and moxibustion. So a lot of times a Tui Na session will include cupping. Yeah, we won't do that today. And then there's two main styles of Tui Na, yin and yang style. So we basically learned the yang style, which was developed in northern China to warm up people in a very cold environment. So it's much more vigorous. The yin style was developed down in the southern part of China where it's hot and humid. And the idea there is to just cool the person down. And the techniques are much more subdued, more holding and smoothing out, relaxing a person rather than trying to invigorate them like the yang style. We do predominantly the yang style here, I guess. Yeah.
That's good.
Okay. So I'll have time for questions afterwards, but I'll just get Hannah on the table here. Maybe some things I could say more about what's it for. So what can it do? It's designed to basically move qi and blood and stop pain. That's what Tui Na does. And so it relaxes and invigorates the sinews. It relieves pain and has a balancing effect on the person. It can treat digestive disorders. It's good for that. Besides the trauma and the musculoskeletal stuff, it can be used for digestive problems, respiratory problems, headaches, anxiety, insomnia. So pretty much anything that Chinese medicine covers. Yeah,
that's great.
So I recommend it. Okay, so
one other thing that I forgot to mention is we changed the location for this online info session. We are broadcasting this from one of our treatment rooms, our group room. So we do have the table in the back. Was that your plan to use the table or a chair?
Well, I can start on the chair.
Okay, that sounds fine.
I think
I'm going to scoot this back.
Yeah.
All right.
Maybe, why don't you turn sideways?
Turn this way.
There you go. So in a seating position, you can use Tui Na just basically to work on the neck and shoulders. And there's a couple of main techniques that we would use in treating the neck and shoulders. There's what you call pressing technique. So that's what you would call acupuncture. And the focus of a Tui Na session is on the channels and on the points, which is different than a regular massage treatment where they're focusing on the muscles and they're looking at muscle groups. And here, while we are treating muscles, the focus is on what point am I working on, what channel am I working on. So do you have any injuries or surgeries that you know about?
Nope.
So I'm feeling, basically when you start out, you want to feel first to see what's going on with the person. You're asking them, do you have any pain? Do you have any tenderness anywhere in the neck and shoulders? Feels pretty tight, but
A little bit of stress, but nothing too
stress.
crazy.
Okay. Any headaches?
Yeah, but that was a couple of days ago. Yeah.
So when you do Tui Na, there's parts of the hand and arm that we focus on. This is called the big fish belly, and you can use that to knead somebody or do this sort of circular motion. And this is called the small fish belly, and that same thing, you can use it to provide what they call a kneading technique on a person. One thing about doing Tui Na is that the length of time that you spend is longer. So for a particular problem, I might want to stay on this area for a good 5 or 10 minutes just doing this. So there's kneading, there's grasping, so I can grasp and let go like this. And then there's kneading and pressing on the neck. So you use the thumb a lot in this style. So I do a lot of kneading using just the thumb. And then this is called the tiger's mouth. And then you can put the tiger's mouth against the person and use that as a part of the technique like this. So basically, you're just working along the channel. Right now, I'm on the gallbladder channel on her neck, and just kind of generally, there's basically 3 stages to a treatment where you're finding out what's going on, and then the next stage they call the analgesic stage, where you're getting in really deep and working to relax the area and stop the pain. We call that the analgesic stage. That's the deepest part. And then the last part is where you're sort of harmonizing and finishing the treatment. When you come upon a little knot like I am right here, you can focus on that. You might want to try using your forearms. We use our forearms a lot. We use our elbows. You can do kneading with your forearms. There's some chopping techniques. And basically, you can also mobilize a person's limb if you need to involve that into the treatment. So I'm pressing down on her trap, and then by raising the arm, I'm kind of doing a massage on her without me moving. I'm using her arm to create the massage. How's that pressure?
You can feel those knots.
Yeah. So in the chair, that's pretty much where you work as far as that goes. You can work down the arm in this position. So I'm working down the lung channel and the large intestine channel. And then you do this type of movement where you're clamping down and then doing what they call cross fiber massage. So the muscle fibers are going this way, and I'm invigorating them, plucking them sort of, to get the chi and blood moving in there. And people that do a lot of repetitive motion have problems in the forearm, so you want to work on both sides there.
It does feel a little bit like plucking of the muscles and tendons. Yeah.
The table height is very important, as it is in all massage styles. And you want it to be just about where your hands hang down to. And then because you can be working for a long time, stance is very important. Basically, we're talking about being in a very stable position at all times, because as you're working, you can end up doing this and like this, and you're gonna just hurt yourself and hurt your low back. And same with your hands. There's lots of ways in Tui Na where you can spare your thumb by adding pressure from the other hand or using your palm. So this is another kneading technique. The sort of defining feature of this is that I'm moving the muscle underneath the skin. So I'm not rubbing on top of the skin. I'm pressing down and I'm moving the muscle underneath. So that's why they call it kneading. So there's sort of a very basic, simple back routine that you can do. And I start by sort of just waking up the back and feeling. I'm doing some exploring now to see what's happening. And then I'm going to do some pressing techniques right down the spine, right next to the spine. These are acupuncture points. And doing this sort of activates the person's nervous system and sort of wakes them up a little bit. No, I'm not doing a real strong pressure here. I'm just doing enough pressure to stimulate these acupuncture points. It goes all the way down the spine, all the way up the neck to the base of it. Then there's two. So then this is similar to what you would say acupressure is, or even shiatsu, where you're working acupuncture points along what is here, the bladder channel. And there's two rows of points that go down the back. So I start out just by pressing these bladder channel points. And I'm not being real exact about their location. I know where the channel flow is, and that's what you learn. That's a good reason to take this course sort of in the beginning, because it reinforces your knowledge of the channel system of the body. You can use the big fish bellies to squeeze together and squeeze the muscle and rotate like this. So then I've opened up the back a little bit and work on the neck. We'll do some more kneading and grasping. You can use your fingers to get in a little tighter, a little bit more specific along the sides of the neck, the cervical spine, basically. These are all acupuncture points in here. And people generally have a lot of tension in this area. And then you just do some focused work. And one of the principles is to always work on the unaffected side first. So I'm picking the side that seems less tight right now. Other way to do it would be to say, does that feel tight? How's the pressure? You want to always be checking in on the person. But basically, I know where people have their knots on their back, and so I'm going there, doing the cross fiber massage down the paraspinal muscles, and then getting into the low back. And you can easily pick the person's arm up, work on their shoulder, and pressing down the back of that arm for another acupuncture channel. The same job. Here, as you put the arm behind, you can see the scapula pops up, and then you can get in with your forearm and your elbow and press some of the points that are always really tender on people. And then you can do a little more vigorous kneading. So kneading is, this is one way to do it, and then vigorous is more like this, and that's kind of defines what Tui Na is a little bit more vigorous, shaking and thrusting type of movements. So if you didn't have knowledge of the channels and the points, you would just be doing a massage, but you would, I've noticed that the difference between Tui Na and the other Swedish and some of the other styles is that the intention of activating those acupuncture points is not there, and it makes all the difference. It really makes all the difference. You can work on their foot. There's tons of points along the foot, rotating, lifting like this, shaking, chopping.
If you have any other questions, please contact me at ACTCM admissions at CIIS.edu. It's CIIS.edu. Or call us in the admissions office at 415-401-0464, and we'd be happy to set up either a class visit, an individual appointment, or come to our open house as well. So
come to our clinic. We have Tui Na appointments.
Mm-hmm. And I've received those as well with another one of the folks here and there. It's awesome. So thank you all so much for your time, and contact us if you have any questions. Have a great rest of your day.
Bye.